Thank you very much and welcome back into the room. The next session will celebrate the 15-year partnership between the Lakeisha Foundation and Gavi. It's a partnership that's been instrumental in saving lives and creating a lasting impact. It's also a partnership that stands as a testament to the transformative power of public-private partnerships in shaping Gavi's immunization and innovation agendas. For the session, I'm delighted to hand over to our moderator, Marianne Sarakayao, who's the Managing Director for Resource Mobilization, Private Sector Partnerships and Innovative Finance at Gavi, as well as her panel. A round of applause, please, for them as they make their way to the stage. Thank you.
Good afternoon, ladies and gentlemen. It's really a pleasure to be moderating this session, celebrating 15 years of partnership between Lakeisha Foundation and Gavi. My team and I have been personally involved in this partnership, which really for us epitomizes a real and true partnership and what can broad value and innovation from the private sector bring. So we will be shining some light on how, such partnership can really raise the profile of immunization within a company, but also become so much more, widening this profile to their stakeholders, customers, and even the suppliers. We'll also hear, of course, how this partnership was set up, how it has evolved, and why it's critical to Gavi and what we do. And in this case, it has been fundamental to our fight against pneumonia, which is today remains one of the biggest killers of children, killing 2,000 children a day across Africa. So when Gavi started introducing the pneumococcal conjugate vaccine, it was really important for us to have partners like Lakeisha. With their support, we have been able to have tremendous results, particularly in Mozambique and Ethiopia, over the past years. I want here, of course, also to acknowledge really the personal contribution of Her Royal Highness Princess Christina, who really, was quite instrumental in helping us in this journey. So let me introduce our two exceptional speakers, the General Manager of Lakeisha, and of course, Dr. Seth Berkeley, who needs no further introduction. We will also be having a video from the Minister of Health of Mozambique, who couldn't be with us today, given the important contribution of Lakeisha. But first, we'll be having a video on Lakeisha.
En 2008, la Fundación Lakeisha se unió a Gavi, The Vaccine Alliance, con un propósito claro: contribuir a salvar la vida de los niños que viven en los países más desfavorecidos a través de la inmunización infantil. Para fomentar la implicación empresarial, se creó la Alianza para la Vacunación Infantil. Desde entonces, muchas empresas se han sumado a esta iniciativa como parte de sus programas de responsabilidad social corporativa. Hoy, esta alianza es un proyecto consolidado en nuestro país que promueve la responsabilidad social corporativa y también la filantropía, desplegando un modelo innovador de cofinanciación que incluye a muchos y diversos agentes, empresas, clientes y empleados del Grupo CaixaBank y también la sociedad civil en general. Además, IS Global forma parte de este proyecto, aportando experiencia científica y académica. Para potenciar la participación de particulares y empresas en esta alianza que salva vidas, la Fundación Bill y Melinda Gates y la Fundación Lakeisha multiplican por 4 cada euro que se dona, cuadruplicando así el impacto en la lucha contra la mortalidad infantil.
La capacidad que tiene una compañía con una inversión muy pequeña de sobredimensionar el efecto dentro de la alianza. Nosotros por cada euro que comprometemos se generan 4 euros disponibles en el programa de vacunación. Eso le da a una compañía pequeña la sensación de tener superpoderes. Y esos superpoderes son superpoderes que transforman la vida de aquellas personas que más lo necesitan, ¿no?
Each organization that participates in these alliances can bring their special expertise. So in the case of the Gates Foundation, we're able to bring philanthropic financing, partnering with La Caixa, which has enormous reach and the ability to attract other companies.
Esta alianza es un buen ejemplo de que sumando esfuerzos se pueden conseguir más y mejores resultados. Asimismo, pone en valor el compromiso de las empresas y del sector privado en la lucha contra las desigualdades. Todas las aportaciones resultan imprescindibles para avanzar hacia los objetivos de desarrollo sostenible en materia de salud global. Por eso, nuestra misión es clara y nuestros objetivos concretos. Juntos, durante estos 15 años, hemos sido testigos de que podemos transformar el futuro de millones de niños. Hemos sido testigos del crecimiento de una nueva generación. Una generación que, gracias a las vacunas, ha podido construir un mañana.
So we've just have a glimpse of what this private sector partnership can do. And we are very pleased, of course, to have you with us, Mr. Antonio Villa-Bertrand. And so I would like to ask you, La Caixa became our first private sector partner, really created a unique private sector model, and has really helped shape, actually, our future engagement with the private sector. So how has this partnership evolved? What do you think are the plans going forward?
Okay, thank you. Bueno, primero de todo, gracias, María-Ange. Segundo, gracias por estar aquí, por dejarme estar aquí, por invitarme. Va a ser bastante difícil que yo les pueda superar lo que han visto en el vídeo, sinceramente. Pero si tengo que hablar de la experiencia, y María-Ange me parece que me pregunta más por el futuro, pero yo quiero hablar también un poco de la historia, ¿no? La historia comienza con una visita de una delegación de nuestra casa, de La Caixa, en el año 2008 a Mozambique, donde Gracia Machel y Nelson Mandela enamoran, entusiasman a la delegación catalana, diciéndole lo que está pasando en el mundo de la neumonía, que tengo que reconocerles que en el caso particular mío empiezo a conocerlo en el año 2020, con lo cual, fíjense ustedes hasta qué punto el director de la Fundación de la Caja era absolutamente ignorante de la situación tan grave que se pasa en el mundo, ¿no? Me pareció que el número de muertes por la neumonía cada minuto, cada segundo, como vosotros me decíais, era alucinante. Nuestra delegación enamora y el entusiasmo viene enseguida reflejado porque se firma con Gavi una cantidad de dinero importante, 4 millones de euros, que se repite un año, 2 años y casi 3 años, creo recordar, y he tenido que hacer mucha historia para poderles contar esto, pero luego enseguida ya hay la gran alianza, en donde se trata de enamorar a las empresas en la responsabilidad social corporativa suya y, por lo tanto, involucrar a todo el tejido español empresarial en un tema humanitario internacional. Este mismo año las empresas empezaron a aportar su dinero y decidimos extender esta campaña después también a los clientes, empresas, amigos, todo lo que el banco, con más de 4.000 oficinas en toda España, puede deparar, ¿no? Tengo que decirles que cuando en el 2008 se produjo esta alianza, nosotros el banco era la Caja de Ahorros y Pensiones de Barcelona. Era una caja de ahorros en donde la fundación estaba absolutamente interiorizada dentro de su balance. Esto cambió en el 2014 y hoy la fundación es la propietaria del 30% de aquella caja convertida en un banco que se llama CaixaBank, pero que obviamente es uno de los pilares de nuestra asociación, igual que la de Bill Gates, cuando Bill Gates, la fundación Bill y Melinda Gates, deciden doblar las aportaciones, como han visto en el vídeo, que se reciben del banco y nosotros doblamos las de ellos, con lo cual de cada dólar o cada euro pasamos a 4 euros, ¿no? Bueno, esto en 15 años origina 89 millones de dólares que permite la vacunación de 9 millones de niños en el mundo, con lo cual nos sentimos francamente orgullosos. Creemos sinceramente que lo único que podemos decir es explicar nuestro ejemplo, porque ojalá se pudiera replicar y escalar, porque el camino se hace precisamente de esta manera, juntando esfuerzos. La experiencia es que cuando el reto es tan grande, uno solo no hace nada. Nosotros en la Fundación y en otros programas sociales que tenemos metodología y, por suerte, dinero que viene producido por una serie de dividendos que da un grupo empresarial que se llama Criteria, que depende también de la Fundación. Pero sin las personas que están sobre el terreno no seríamos capaces de hacer nada. Las entidades sociales que están en el terreno, y cuando digo entidades digo ONGs, las personas que están en Mozambique, hemos conseguido el 100% de la vacunación de Mozambique y en el año 2021 el 44% de Etiopía. Son retos inimaginables hace 15 años. Por lo tanto, nos sentimos orgullosos de eso, ¿no? No quiero dejarme nada, tengo una chuletilla aquí con ustedes. Obviamente elimino muchas cosas porque las han visto en el vídeo, ¿eh? Bueno, si me permiten un apunte personal, ¿no? Lo he iniciado, pero yo inicié mi vida en la Fundación el año 2000, en enero del año 2000, cuando vosotros realizabais un summit en Barcelona, bueno, y también vinimos a Madrid, ¿no? En enero de 2020, faltaban 2 meses para que en un microbio, un virus que había en China, que parecía que no tenía que llegar a inundarse el mundo, ¿no? Bueno, si las vacunas son importantes, cuánto más no lo han sido en este periodo en los países del tercer mundo, ¿no? En donde se ha visto una diferencia de rapidez en la aplicación de esas vacunas, ¿no? Decirles que creo que es lo que más Marianne estaba preguntándome, ¿no? Termino diciéndoles que nosotros seguiremos comprometidos, ¿eh? Seguiremos comprometidos con Gavi, ¿eh? Para tirar para adelante la misma colaboración. Si podemos doblar, pues doblar, y creemos que esto es un buen camino para que dentro de 10 años digamos hemos conseguido no sé cuántos millones de vacunación y Etiopía ya está al 100%, ¿eh? Pero yo solo puedo decirles el compromiso que tiene la Fundación La Caixa. Está claro que en una fundación con un presupuesto elevado hay prioridades. Esta es una de ellas, sin ninguna duda, ¿eh? Muy pocas cosas podríamos hacer mejor que continuar con esta feliz alianza empresarial y social, ¿eh? Y gracias por su atención.
Thank you, Mr. Villa. Thank you for the incredible support, and we are pleased to hear that this collaboration will continue in the future and to continue to save lives of many more children. So, of course, our collaboration wouldn't be a collaboration with one of the key countries that you have supported, Mozambique. So I'm very pleased now to introduce the Minister of Health of Mozambique, a long-standing partner of both La Caixa and Gavi. And so we'll now have a video because he couldn't join us today.
Okay.
He will talk about, the challenges that, of course, he's facing in his countries and why this continued support is needed.
Ladies and gentlemen, distinguished guests, it is an honor to virtually join this meeting today, representing a country that has been a key long-standing partner of Gavi, the Vaccine Alliance. As we celebrate 15 years of partnership between Gavi and the La Caixa Foundation, I want to highlight the remarkable impact of vaccination, particularly in combating childhood pneumonia in Mozambique. Childhood pneumonia is exacerbated by factors such as malnutrition, limited access to healthcare facilities, and weak health systems. Despite these challenges, Gavi's partnership with Mozambique has yielded impressive results. Through the support of dedicated partnership like La Caixa Foundation, we have made significant progress in increasing our pneumonia vaccination coverage rates. I want to express my deepest gratitude to the Foundation for their unwavering commitment and for the supporting of 100% of Gavi's pneumococcal vaccine supported to Mozambique in recent years. Their generosity has made tangible difference in the life of our children. However, the COVID-19 pandemic has generated unprecedented challenge to the routine immunization effort, disrupting healthcare services and treating our progress. This is where the continued support from Gavi partnership, like La Caixa Foundation, becomes absolutely critical. Today, I'm here to call upon all organizations and stakeholders to be inspired by this successful partnership and join us on implementing similar initiatives. Together, we can build a healthy and brighter future for all. Thank you.
Thank you so much, Minister. So, Seth, look, we know you have been a fundamental supporter of private sector during your time at Gavi. So tell us, why is it so critical to be able to continue counting on these type of partnerships to deliver on our promises?
Well, thank you for the question, and let me start with thanking my good friend for the announcement of continuing to work together. I think, in a way, I'm just going to repeat what you all said, but here's a really good example. First of all, it's not a short-term partnership. 15 years is a long time, and the amount of effect, 9 million vaccinations, this is a big number. The more than $80 million that has come. But I think for me, there's a couple of other really important points. One is the innovative nature of this. So the idea, yes, money is important, but what you did is you not only brought money from the bank, but you also brought money from your employees, you brought money from other groups that were interested, and that built a larger support base. And so as we look at the effects of that today, when I had a discussion with the foreign minister of Spain, and he said, it's easier for us to support Gavi because people know what it is and know why it's important. And he gives part of the credit to the fact that there is this broader social movement that is going on. And why is that important? We all know, we're the believers here, but we also know that there's tough fiscal times in the world. We know that overseas development aid is going to have pressure on it. And what's really fabulous is to have not only the support of the private sector, but also to build this network of people who understand why what we do is important. So for us, private sector brings long-term relationships, brings a social movement, and of course brings innovation. And so for me, I really want to thank La Caixa for what they've done. I also want to acknowledge Princess Christina, who also served on the Gavi board as an independent board member, in addition to the role that she's played here. So, I think this has been an important part of the work we've done of building relationships here and trying to get people to understand the importance of what it is we're really trying to do.
Thank you, Seth, and thank you to Mr. Villa again for joining us with all his team here. And I think now it's time to celebrate. So happy 15th anniversary. And I think we have a cake to blow up. So we do have to get up, I think.
Wow. Oh, be careful.
Okay, thank you. So you should come.
Join us. It's an order. Go.
It's not blow up, blow out.
Okay. So I guess.
The princess allowed to blow?
Yes. Are you? Can you do it?
Can you do it?
Yes. Allez, go ahead. Ah, oh my God.
Okay.
Well, thank you so much for joining us, and please stay in this room because we are continuing with the next session about more private sector partnership. Thank you so much.
Oh, that's a kiss. A kiss.
For celebration.
Thank you.
Bye-bye. See you.
I think we are taking the cake with us. Sorry.
The difficulties we normally face in during carrying out such activities, the transport and the distance. The terrain is so bad to reach such an outreach like Mukungu. When it's rainy season, the place is so slippery. We find us walking. When it's dry season, the place is so, there's a lot of wind. The movement is not lovely. Imagine a mother has just started labor, has got obstruction, they have to close the leg to look for services. It's really hard. People feel very excited when we visit their homes because they really need the service. Actually, when you go to nutrition assessments, you find most of their children are underweight. Most parents understand the need of vaccination because they make sure to go and seek the service, so they really know. In those cases who fall out, we normally follow them up. We don't allow them to remain behind. What motivates me to do my job every day? When I go to maternity, I deliver life, then I'm motivated. When I treat a case and that person becomes fine, I get motivated.
All right. The video that we just shown you was the efforts Micheline Uwimana, a Ugandan healthcare worker, makes to undertake to reach zero-dose children in remote parts of the country, boarding boats and hiking hours over mountainous terrain. She really embodies the hard work and resourcefulness of the vaccinators that are at the front line of our vaccine alliance. It is nearly time for our next panel, but just a thank you to our distinguished guests and panelists, and Marianne for really moderating that discussion so well. We know that if you want to leave healthcare, I know that there is a moment for you doing what I'm doing right now. It's time for a 2-minute break. Please may I ask that we stay in our seats. The next session is going to be called Health for Wealth, Catalysing Sustainability. I'd like to ask our guests to please make their way to the stage. We've just heard about that long-standing, amazing partnership between Gavi and Lacacia, how it not only led to some pretty amazing direct impact, but also helped set a precedent that has since seen the Vaccine Alliance enter into dozens of highly innovative partnerships with business and civil society. It's time now to take a look at this aspect of the Gavi model in more detail, and crucially, how partnerships are helping bridge the gap between immunization and other system-level challenges such as nutrition and sanitation. Now, in order to help us understand just how these partnerships work in practice and how they've become so transformative, I'm delighted to be joined by a wonderfully diverse panel of speakers. If I can ask them to please make their way to the stage. His Excellency, Mr. Kwaku Manu, who's the Minister of Health in Ghana. Ms. Rachel Bale, the Senior Vice President, Humanitarian and Development for Mastercard, Inc. Professor Ahmed Aljedai, the Assistant Deputy Minister for Therapeutic Support Services in Saudi Arabia. Ambassador Dr. Anders Nordström, who's the Ambassador for Global Health in Sweden. And Ms. Anna Hakobyan, who is the Chief Impact Officer at the Children's Investment Fund Foundation. ask you to take what you take. Okay, that's fine. That's fine. Thank you all so much for your time this afternoon. Really glad to be moderating a conversation with you. Minister Manu, perhaps I'll start with you. Thank you so much for joining us. And I'm sorry, I think I'm going to go into a technical thing as well. I am multi-talented. I'm going to demonstrate that shortly. All right, that's a little bit better. Okay.
Good.
All right, so let's start with you, Minister Manu. Ghana's really been at the forefront of leveraging these public-private partnerships that we're speaking about, especially helping when it comes to vaccines on that critical last-mile stretch in their journey, reaching zero-dose children. This is so important, and we saw that during the pandemic. So can you just please share some insight into how effective those kind of partnerships have been?
I think we've had one very major innovative partnership with the corporate we call Zipline, with massive support from Gavi. Gavi supported Zipline to set up infrastructure that will fly medicines, blood, and especially vaccines to very hard to reach areas of our country. We have challenges with riverine areas. You're aware Ghana has the largest man-made lake in the world that gives us electricity. And the dam created islands on the river and where we have people living and working without easy access. Prior to getting the drones flying, we were actually using boats to reach people to vaccinate them. Mothers were supposed to bring their children from the islands for vaccination, and that wasn't the best. We were not doing better coverage. So this partnership has helped us to do a lot. We started about 2 years back, and presently we are doing drone services to deliver medicines and blood products, vaccines, and other pharmaceutical commodities to hard-to-reach communities of the country. Across the country, we have 6 distribution centers that has state-of-the-art, world-standard warehouses that stocks vaccines and blood. All types of vaccines can be stored there. And they are the instance of the health centers. Anytime they need something, they order, and they deliver within 15, 20 minutes. So we have added the drone service as part of our last-mile distribution channels that does vaccines to our vaccinators to support these children. The 6 centers are serving over 2,500 health facilities in 13 regions out of the 16 regions that we have. From time to time, we'll get flooding. There is a huge dam in Burkina Faso, just north of Ghana. And anytime the dam is full, they spill it over. And some parts of the northern region of our country gets flooded. When it happens, you can't go by road. There are no boats. So the only mechanism is to fly these vaccines for support. And it is helping us that much. As of December 2022, the service had made about 144,000 deliveries across all the 6 distribution centers, representing 26% increase in total deliveries from the previous year. So that is helping us. And despite COVID and all the disruptions and all that, by close of 2022, Ghana's vaccination coverage DP3, Penta 3, was around 98%.
Okay.
Which is quite significant.
All right, that is
so that is a major partnership that we have, quite innovative with technology-driven efforts.
Rachel, we're hearing that very impressive statistic about what's happening in Ghana. It's really impressive to see the innovation that drones are having there, literally saving lives by getting vaccines to communities where it would have been otherwise difficult or slow to reach. Just talk to me about how, as a technology company and as a long-standing Gavi partner, your contribution has helped transform vaccination tracking and immunization record keeping. Just tell me more about that partnership.
Thank you very much. I don't know if this is working. Okay. So thank you very much. Actually, during the COVID-19, we were able to develop an all-digital solution to not only track immunization, but also handle everything around the pandemic, which includes but is not limited to the fact that we had to issue a health passport for travelers across the board, showing their vaccination records, health passport showing whether they are infected or not. The vaccination was an important aspect of the digitalization and digitization that we also worked on in Saudi Arabia, including the fact that we had implemented access to all individuals residing in the country to access their records, to access where they can be vaccinated, the availability of vaccines, the number of doses, and all matters related to vaccination. This was actually expanded after the pandemic, or during actually the pandemic, to include all other vaccines. Now we can track all vaccines using the same digitization or digitalization app that's available for all residents and nationals in the country, also for visitors. As you know, Saudi Arabia has a unique position when it comes to the religious tourism. So we have about at least 3 million of pilgrims coming every year in a very short period of time. We track everything related to their vaccination through an app as well. Not only this, our target is to have 100 million religious tourists by 2030, and currently we are in the middle of that, achieving that target. Everything is tracked and traced using their digital passport, health passport, including vaccination and other diseases as well.
All right. Rachel, let's stay with the technology. I'm just checking that you can hear me. Let's stay with the aspect of technology and how it's really helping change healthcare.
Yeah, absolutely. So Mastercard is rolling out a platform called Community Pass with our partners in low-income countries. And that platform is focused on not just financial inclusion, as you'd expect from Mastercard, but also solving some real challenges in getting access to critical services for end users, even if those end users don't have a foundational identity, a digital footprint, or even access to a mobile phone. So we do this by providing a user or a patient with a card that looks like a bank card. It has a chip on it, and that chip securely stores the digital health record of that patient. And so what we've given them is a portable, very secure health record. And that health record can be read when they visit any health facility with the Community Pass application on the tablet that the clinician uses to read the health record off of that card. And so in that way, the health record can be, the secure health record can be accessed and read even if the clinic is offline. So there's no requirement for ongoing connectivity of those clinics. However, when the clinic does sync their data, and that might be once a day, once a week, then that data automatically gets synced up to a district level, a regional, a national level, therefore giving more robust, more timely quality data to improve transparency and decision making as well. And we've found in our proof of concept in Mauritania with our partner Gavi that improves things like stock wastage because the clinic's usage of their stocks is being transmitted up to the district and national level in a much quicker way and without using a lot of valuable clinician time to do that as well. So we've been live in Mauritania for a couple of years now, and we're going to be going live in Ethiopia later on this year. Mauritania was focused on childhood vaccinations, and Ethiopia was starting with COVID vaccinations, and that's, of course, with Gavi, with the ministry, but also with the partner, JSI, as well. And in addition to that, because of the way that we've structured the way that the data can be stored on the chip, multiple different types of data sets can be stored separately and securely on that chip, which means that we can have multiple different types of health records on that chip, or indeed other appropriate related applications, such as health insurance data, for example. And by spreading the use of the infrastructure, the platform, the card, the tablet, that way we're also spreading the cost, because we're focused not only on scalability of this, but also the long-term sustainability of this. And so the more we can use that shared infrastructure across multiple use cases, the more we spread the cost, and the better in terms of commercial sustainability this will be.
All right, thank you so much. Professor Nordström, you've been working with Gavi since 2000. You've seen so much. What would you say the main lessons in your mind are about bringing out the best of the private sector partnerships to provide solutions to immunization challenges?
Thank you. First, I'm delighted to be appointed professor. Thank you.
No. Am I
will bring
that
me with me that back home, because I'm stepping down now as an ambassador, so I will be a professor instead. In terms of private sector collaboration with Gavi, I don't think Gavi would have been where Gavi is today without a very both fruitful but also very strategic and structured collaboration with the private sector. I mean, three aspects. First, of course, the discovery of new vaccines, the research, mainly done by private partners, the production. I'm old enough then to remember one of the Gavi board when the CEO of the Serum Institute was at the board. The Serum Institute at that time was tiny. Today, they are huge. So the way that also Gavi has worked with private partners, and I'm sure also in Africa we will see the same development as we saw then in India and China many years ago. But then there is a need for a private partner here. Gavi is not a private partner who can actually produce the vaccines. You need the private partner to do that. And I think also, as we heard around some of the systems, some of the logistics, and let me just share one sort of small history, because now today innovation is much more advanced with drones and SIM cards and other things. But in 2006, I was the acting director general then for WHO. And I attended the G8 meeting in St. Petersburg with all the G8 leaders, and I had 3 minutes to speak in front of them about health. And I had brought in a vaccine ampulla and a Coca-Cola bottle. And my message was, why are we reaching out to the communities with the Coca-Cola and not the vaccines? And President Bush came to me after the meeting and said, I got the message. I'm not sure he did, because my message, and I think the message for us, is that technologies, yes, but what is even more important is people's behavior, people's values, what people are demanding. And of course, what we would like to see people demanding in the world is less of Coca-Cola and more of vaccines. And that requires different kinds of skills as well. And I think the private sector are quite good at this when it comes to marketing. And I think we, as a global health community or local health community, need to learn from how nudging marketing is actually working to ensure that people are making the right choices.
Just to follow up on that, would you like to see more Gavi engagement on specifically private sector partnerships?
Yes, I think so. And I think one needs to also then make the arguments clear. The title of this session is Health for Wealth. And I think private sector do realize that we need more healthy people. We need people that can work and can produce. I mean, the Swedish history lessons looking back now 50, 60 years was that private sector saw the importance of investing in health. They saw the importance of investing in education, and we have a very good system today. But that enabled then more women to enter the labor market. So that was a really clear deal in between the private sector and at that time the Social Democratic governing party. So Gavi needs to engage the private sector with the right sort of arguments and opportunities. We need wealth. We need wealth in the society. We need economic development. But this is also business opportunities, of course. And that is part of what Gavi can offer. And I think that's also why we see some private partners actually investing in Gavi today, because they see that Gavi is a very useful partner also to creating some of those business opportunities. And the final reason is then, as I said, there's a lot of ways of working from the private sector that we are already benefiting from, like what we heard from the minister from Ghana in terms of the drones. That is not coming from public sector, that is coming from private sector. So we need those in order to be more successful.
Thank you, Ambassador. There is donor appetite for innovation, and the Gavi matching fund remains a really great incentive for potential private sector partners. That mechanism, of course, serves as a catalyst for private sector funding and has allowed Gavi to consider joining forces with philanthropies focusing on a wide range of child issues. Now, Anna joins us today as the Chief Impact Officer of the Children's Investment Fund Foundation. Anna, we know you're so passionate about measuring the effectiveness and impact of everything that Gavi does. You were founded in 2002 and quickly became one of the leading philanthropies focusing on children and climate change. So just talk to us about how working across multiple systems helps reach the most vulnerable people and where we see the highest number of zero-dose children.
Thank you so much. And it's a pleasure to be here, especially, as a Chief Impact Officer. I'm so pleased and proud to see Gavi being so keen on outcomes and impact and evidence and doing this media review of impact that Gavi and the partners have been driving so hard to be achieving goals. So at the heart of CIFF's vision is a world where every child can survive and thrive now and in the future. And we know at the moment that over 1 billion children are still living in poverty and lacking access to such basic services as healthcare, water, food, nutrition. We also know, those of us who work in international development and global health, that children and families do not experience life in silos and in fragments. They are a whole. And yet the way development assistance flows currently is not really matching that reality. I think we are all aware very well. We go and talk to communities about your child needs a vaccination. Here, one day, we go and talk to them about the needs for deworming another day, and then there's need for nutrition services somewhere else some other day. And I think by doing this, we're really missing out on some significant opportunities for maximizing health benefits and outcomes for children and families. So in realization of that goal, we really want to be clear, and we think it's now time we put the needs of the child, the holistic needs of the child and their well-being at the heart of all we do. And with that in mind, we're very pleased to be joining forces with Gavi to actually roll out some integrated services, leveraging our nutrition, immunization, and health platforms to maximize the health outcomes for children, and also at the same time save some precious resources and time that goes from caregivers and healthcare workers in delivering those services in a disjointed way. So we think it is a double win. First and foremost, stronger outcomes for children, but also, importantly, precious resources saved for caregivers and healthcare workers. So CIFF is very proud to announce a joint partnership of 30 million with Gavi, using the Gavi Match Fund mechanism with the goal of integrating immunization and nutrition services in Ethiopia, delivered through a strategic partnership with UNICEF and its Child Nutrition Fund, which is offering some innovative program and financing solutions to high-burden countries. In Ethiopia, we know that hard-to-reach communities is where we find the highest burdens of malnutrition, as well as zero-dose children. The Ethiopian government has very much made a call to action for more integrated services, and indeed they've also been paving the way already by trialing out and piloting those integrated services. So this partnership, we really hope will push this and take this to the next level. We're very excited about the evidence generation opportunities of this partnership also beyond this particular program in Ethiopia, because we're hoping we can do this in more countries with more partners and in more sectors to really try and put the child at the heart of all we do.
All right, I'd like to thank you all for sharing such compelling insights and giving us insight into the work that you're doing in the different sectors that you are. I'd now like to stay with that theme and watch a short video from Her Excellency Dr. Tadesse. She's the Minister of Health in Ethiopia.
Honourable Ministers, heads of agencies and development partners, distinguished participants, first I would like to thank you for this opportunity to speak on Gavi's midterm review on this occasion of launching the Nutrition Immunization Nexus project. I would have loved to be here in person, but I'm happy to send this message online. Ethiopia has leveraged different partnerships to expand immunization and nutrition services with improved quality. Despite the progress and expansion of immunization programs, we are still striving to reduce the high number of zero-dose children. The world saw the worst decline in routine immunization in 30 years with the COVID pandemic that has exacerbated the backsliding in immunization rates. And this context is the same with the nutrition program. Hence, we are at a critical juncture to welcome such new, integrated, and innovative approaches. Gavi and CIFF are joining forces to help reach zero-dose children who live in settlements or hard-to-reach areas unable to access basic health services by integrating nutrition and immunization programs. While this is very important to ensure demand and compliance for the immunization program, it also ensures one umbrella service, a basic principle of integrated services within the primary health care, an impactful intervention for child survival and development. The Ethiopian government has piloted integrated measles and nutrition interventions, and this will be an opportunity to expand and institutionalize these initiatives. With a vision to see all Ethiopians with optimal nutrition status, quality of life, productivity, and longevity of life, Ethiopia is striving to ensure food and nutrition security through coordinated implementation of nutrition-specific and nutrition-sensitive interventions. Together, as stated on the Sakota Declaration, we aim to end malnutrition in Ethiopia by 2030 and catch up on routine immunization coverage. In response to our needs, we have been fortunate to have fruitful partnership with many of you in this conference. And just to mention two, Mastercard, Gavi, and the Ethiopian Ministry of Health and JSI are implementing the Mastercard Wellness Pass solution with Ethiopia's health information system and aim to bring efficiency in healthcare tracking and offline portability of health records in the most marginalized communities. While Gavi, the Vaccine Alliance, and the Girl Effect Partnership are working on demand generation. We highly appreciate these collaborations we had so far with key roles to achieve the national and global targets Ethiopia is committed to. Coming to today's main agenda, the launching of CIFF and Gavi matching fund supported by the UK to fund for nutrition immunization nexus. This is quite timely. For Gavi's next strategic period, which aspires a strong and resilient integrated primary healthcare services for addressing the last journey of zero-dose and underserved community agenda, this nutrition immunization nexus will pave the way for the Gavi 6.0 strategy. Therefore, I would like to sincerely appreciate the support of CIFF and the UK through Gavi and would like to reaffirm our commitment to ensure the effective implementation of the project to get the optimal impact and result out of this partnership. I thank you.
Let's stay with that theme. I'd like to please call on stage Dr. Muleken Johannes, who's the Special Advisor to the Minister of Health in Ethiopia, to explain how partnerships like this are helping Ethiopia's Ministry of Health meet its broader targets, as well as Ms. Beth Arthy, who's the FCDO Deputy Permanent Representative Global Health at the UK Mission in Geneva, to hear about the Gavi Matching Fund. Please may make your way to the stage.
Thank you so much, and congratulations to Gavi and the Government of Spain for convening us in such a wonderful event, and thanks to the panel. As Minister Mitchell talked about in his video earlier today, the UK is absolutely passionate about doubling down our collective efforts to reach zero-dose children, usually the most poorest and marginalised children. We, as part of our £1.65 billion commitment to Gavi, ring-fence £25 million as match funding to help leverage further financing from private partners. We're really delighted today to commit £15 million from that match funds to leverage a further 15 million from CIFF to support the government of Ethiopia's efforts to roll out this absolutely essential integrated approach, combining delivering nutrition services with immunisation services. We absolutely believe this is a really important way forward in both reaching the poorest children as well as strengthening primary health care. And we're absolutely delighted to support Minister Tadesse's call to action. Thank you.
Okay. Thank you very much. I mean, everything has been said by Her Excellency the Minister. It was well articulated. And we would like to thank also the donors in this partnership, actually. So this grant or this partnership has actually a very important, deep meanings in terms of actually addressing the real needs of a child at distant areas. This is very important. And the other thing, then actually, as Ethiopia is actually aspiring to create a very strong and resilient primary health care, this is also very important, and this is going to be very learning for us actually. So in terms of actually creating and scaling up of this strong and resilient primary health care. Ethiopia is actually addressing most of the vaccination programs, like 70% of the vaccination program at the lower level. So integrating those basic services, which have really a vital impact in terms of improving child survivals. This is a lot for the children who are actually at the remote area. So what I want to say is actually thank you, and this will be a learning, and definitely we will learn and we will try our best to get the most out of it. Thank you very much.
Thank you so much, Dr. Mulliken, and thank you, Ms. Arthy. What a great example of private-public partnership in action. Thank you so much for your time this afternoon. Right, I'll now take this opportunity to make another announcement on behalf of Mr. William Moore, the CEO of the Eleanor Crook Foundation, who unfortunately could not be here today. We know that separately, malnutrition programs and immunization are some of the most powerful interventions to prevent children from dying. But how much more can we achieve by bringing them together? The Eleanor Crook Foundation is contributing $1 million matched by Gavi to try and answer this question in Nigeria. I think that deserves a round of applause. All right. Our final announcement for the day will be given by Emma Sargent. She's the President of Europe for DAS at Omnicom Group and Managing Partner of the 100 Europe.
Thank you. Thank you. Thank you to Gavi and the Spanish government for hosting this wonderful event, and I'm delighted to announce as Omnicom, we are a global marketing and communications company. We work with many of the biggest brands in the world. Unfortunately, not Coca-Cola, but Pepsi is one of ours. And hopefully the activities that we can help to support with our commitment to $1.5 million of services in the next few years will include Strategic Communications Council, creativity, innovation, and insights for campaigns and activities in demand generation, digital communications, roadmap assistance. This is part of our corporate commitment to SDG 4 for education, and is a focus of our partnerships is to help with health equity, which we are very committed to. We're looking forward very much to working together in our small part to try and solve the challenges ahead. Thank you.
Thank you very much. Thank you so much. It's great to see the journey that Gavi has gone through when it comes to private sector engagement, from the financial institutions like Lacacia to digital entrepreneurs, large multi-sectoral philanthropies who all channel their expertise to try and drive Gavi's mission. Before we open the floor for questions, I have a follow-on question for our panelists, and I'm going to ask that we keep it brief so that we have as much time for interaction as possible. Would you have any suggestions on how Gavi can further engage with the private sector partners in both donor and implementing questions? I don't know if we should start from that end and make our way here.
I think that often, coming from the private sector and then partners like Gavi, we often talk a bit of a different language, or we have different priorities or different timescales in terms of our perspectives. And so I think in terms of that engagement with the private sector, I think absolutely continuing, being very open with the dialogue so that you can sort of work through what those hurdles are. And it's certainly something, I've had some discussions with Gavi friends over the last couple of days, and I think that's certainly something that has come up quite regularly, that we need to make sure that we're having very open, candid conversation, because I think there's sort of a natural, sometimes disconnect in our perspectives.
Thank you so much.
Okay, so basically, I think Gavi has been doing great with regards to public-private partnership, but they could benefit from expanding the coverage of localization of vaccines manufacturing in different areas of the world, so that we, in any case where we have disruption of global supply chain, would be easier to diversify the vaccines from different producers. I've seen, the efforts that Gavi has been, doing over the past, 10 years, and they are really commendable, but I think there are lots of room for improvement when it comes to localizing these manufacturing facilities in different parts of the world. For example, in Saudi Arabia, we have been trying to localize vaccinations manufacturing, and we have started our privatization strategy over the past 5 years, and we are currently open for investments. I think it's going to be a win-win for everybody, for patients, ultimately, for Gavi, and also for the private sector as well.
Thank you very much.
Yes, thank you very much, and I'll try and be very succinct.
Thank you.
So the answer is yes. I think we should be doing more, but collaboration with private sector, I think, has always been at the heart of Gavi's model. So we should also thank and congratulate them for the work that they've already done. We're very excited to do more as a private foundation with Gavi, and indeed already some ideas are, coming about around different age groups, adolescents, for example, around HPV vaccine and opportunities for integration with health and education services. So I think there's definitely more potential to join up forces with Gavi and private philanthropy.
Okay.
No, thank you. I was mentioning before 3 sort of core functions when it comes to or areas for collaboration: discovery, production, and delivery. On the discovery part, still remembering when the investments were made to get the rotavirus vaccine, a new vaccine for something very important. Now we have the experience from the COVID-19 vaccines and using mRNA technologies. And if I look big picture in terms of what is really affecting people's health across the world, infectious diseases are going down very good, but non-infectious diseases, the non-communicable diseases, are going up, like the cancers, the coronary heart diseases. And one might think that those are diseases only affecting wealthy people. Not true. 85% of the premature mortality in the world, 17 million people dying from those, are in low-middle countries. Those are poverty diseases, including the cancers. And we have 2 vaccines today that have been very effective also addressing the burden of cancers, the HPV, of course, but also hepatitis B. So the question is, what is in the future here in terms of discovering new vaccines using the mRNA technique here? I know that that is very much at the agenda for people or for private partners and researchers, but it might be that Gavi should be brave here to think about what is really the disease burden, what is really affecting people, and thinking, again, can we get a new product here that is quite out of the scope of today?
Okay, Minister?
Thank you very much. I think my colleague from Saudi Arabia was mentioning regional manufacturing. That is very, very critical. And like the Swedish minister said, discovery, research to develop the vaccine, manufacturing, and distribution. Gavi procures quite a lot. We're getting indications that Gavi is ready to support regional manufacturing. But in terms of procurement And what again? Support to manufacturers that are in the private sector. We need technology transfer as well. And so Gavi should collaborate with private sector, those that have the technology to transfer to ensure that we succeed in our efforts to do manufacturing in all regions across the globe.
Thank you very much. We have 10 minutes left. I'd like to find out if there are any questions in the audience. If there are, please may I ask that you raise your hand. A roving mic will come to you. Please introduce yourself. Let us know where you're from. If your question is directed to someone specific, and please may I ask that we keep it as brief as possible so we can have as much interaction as possible. Opening up the floor for questions now. Are there any questions from the floor? Okay, there's a question, the gentleman in the blue and the gentleman in the red tie as well. Yeah? Whichever works. You can go. I think it's the minister. Yeah. Minister from Central African Republic.
Merci. Merci beaucoup pour cette session qui est très importante, très novatrice, puisque nous, dans le monde de la santé, on doit, particulièrement dans les pays en développement, inclure cette dimension de coopération avec le secteur privé dans la santé et surtout le concept de la santé pour la prospérité. Ma question, c'est à madame, bon, je m'excuse de ne pas retenir, mais qui s'occupe de Mastercard. Mais c'est un peu aussi pour tous les partenaires qui sont engagés dans l'appui à l'Afrique à travers des initiatives particulières. Et ma question à tout le monde, en fait, c'est dans quelle mesure on va adopter une approche totale, c'est-à-dire une approche qui permet d'assurer une couverture totale des populations en services, en méthode, en technologie, afin qu'on puisse savoir dire à quel moment on commence une lutte et à quel moment on finit. Puisque ici, il y a de très bonnes idées. On va commencer Mastercard en Éthiopie, on va le faire en Mauritanie, mais c'est très important le Mastercard. C'est valable pour tout le monde. Mais à quel moment ce Mastercard, qui est un outil important, va atteindre toutes les populations qui sont dans le besoin?
Thank you, Mr.
It's a great question, and I think it talks to scalability that we talk about a lot, that none of us want to be continuing to do siloed pilots that can't scale. We know that every time you continue to grow, continue to scale, you can bring best practices, you can bring lessons from other countries and use cases as well. And certainly, for those of you knowing Mastercard in the payments world, we obviously have a very ubiquitous experience and technology that touches across every country. And our ambition would be to work with partners to create a parallel ecosystem that brings value to all countries, including low income. I would say maybe just patience for now while we try and make it work in the first few markets. But I agree. I think if you don't know when you go in that you can scale that to multiple markets, multiple use cases, then we shouldn't be doing it. And so, that's absolutely the going in approach, that we will get there, because otherwise it's not worth the significant investment from all of our partners. Yeah, completely agree.
Thank you. The gentleman with the blue dotted tie here. I'm just checking if there are other questions on the floor, and then the gentleman at the back there, if a mic can get to him, if there is an extra one with the dotted tie. Yeah.
Great. Thanks very much, and good afternoon, panelists. My name is Stavros Nicola, and I'm wearing two hats today. The first is I'm with an organization called Aspen Pharmacare, which is Africa's largest pharmaceutical manufacturer. And the second hat is I co-chair the World Economic Forum, CEPI, and Academy of Medicine Sustainable Production Initiative, which is something that was incepted in Davos 2022. It's in the latter capacity that I wish to make a comment rather than ask a question. And the comment is, it's very heartwarming to hear and learn of all of these public-private partnerships. Very generous donors, all very much appreciated on my continent, because we know what we went through during COVID and can never ever afford, as a minister from Ghana will tell you, to have a repeat of that ever again, where lives and livelihoods were lost that could have been saved. So my comment is more aimed at when we think through these public-private partnerships, let us also bear in mind that the only way to sustainably solve any current or future crisis in public health is to build local capacities and in the regions and to sustain those capacities. So any PPP, any donation should speak to building local capacities, local capabilities, and above all, in my continent, retaining skills which are readily unavailable, and the precious skills that we have, we lose them if we don't sustain these facilities. Thanks very much.
Thank you very much for your comment. The gentleman there with the glasses. I don't know if anyone would like to respond.
Hello.
Before we move on.
My name is Subhi Qureshi from ZMQ, a technology for development organization based out of India and Canada. And I would like to give a suggestion that we are limiting ourselves to public-private. We are not talking about public, private, and people. People-centric approach, like we see in our, even in this whole conference, there is no representation of the communities here. We see a lot of films about what is being done, but the participants are not from the communities. We have to learn and sit with the communities to design with the communities to be able to, and then the private investments and everything should fall in place.
Thank you very much. Would anyone like to respond to that, either of those two comments that we've just heard?
So I would like actually to respond to the second comment, and I fully agree. Building local capabilities, know-how transfer is extremely important for making sure that we address the first gentleman's question in terms of taking a holistic approach, and also addressing the third comment with regards to people's engagement. I think it's very important, if we take a holistic approach, engaging people, making sure that we transfer the know-how and build capabilities, local capabilities in different regions of the world. At least we make sure that the vaccines are available. That's number one to start with. There are multiple other factors that would be taken into consideration when it comes to taking the holistic approach, including, vaccines hesitancy, affordability, misinformation, misconception. All of these issues needs to be taken into consideration absolutely. But without the availability of vaccines, we cannot address other issues. We cannot just, educate people. We cannot inform. We cannot make them aware, where we cannot build our own capabilities to make these vaccines affordable and available to everybody who deserve them. So that's my comment.
Thank you. Yeah.
No, just a comment in terms of using this word, building the capacity. I think in some way it would be healthy to think about where are the resources coming from? Where are the resources in place? And where are we most successful? I would say we are most successful when we have communities that are actually driving this themselves, setting the agenda, when we have governments providing the leadership, and we see more and more of that. And I think what we're speaking about here, about Mastercard, Gavi, etc., the resources we provide are actually quite small, relatively seen to what is actually being available in countries, and could be available even more in countries. So let's get the perspectives right here in terms of where is the drive, and where is the drive coming from more and more. And I think we need to be working with that and not think that we are the ones that are going to solve the problems.
Thank you. I have room for one more question, and I would love it to be a woman. I think our panel on stage is gender balanced, but the questions I've been hearing have been in very baritone voices, so I'm checking if there is any more question from the floor coming, preferably from a woman. If not, we're going to wrap up the session. All right, making a call then, checking. Thank you all so much for your time and your insights. It's been really appreciated. Thank you for your contributions from the audience. You are released from the stage. Thank you very much, and good afternoon.
Thank you.
Thank you very much. Thank you.
Thank you. Great job.
Thank you so much. Yes. Sorry, can I ask you to stay on stage? All right, I will be at the... Which way are we doing it? I feel like I should be at the end. Okay, you can go. Thank you. Thank you. We still have 45 seconds. All right, please may I ask everyone to stay in the room. We have one more short, brief, very exciting session where we're going to wrap it up. For the final session of the day, I'll be speaking to David Marlowe. He's Gavi's Chief Operating Officer, who will share his thoughts on today's rich discussions. That's going to happen in a moment. David, please may I ask you to make your way to the stage for that final session before we go to the afternoon. It's been a long day, but a hugely rewarding one. We've learned in some detail about all the effort that it's taken for the Alliance to get to that 1 billion milestone, how the Alliance has managed to stay on track with its key commitments since 2021, but also, crucially, what it needs to double down on the work that needs to be done. Please may I ask for some silence on the floor. I'm so sorry to be so bossy, but it sometimes does come out. We're going to continue this discussion. David, thank you so much. You're going to give us a perspective on this big day that we've had. We don't have too long. I know people want to get ready for the next part of the session. So we've heard some very positive updates today and yesterday on the progress that Gavi is making. We also heard about some of the challenges. What would you say are the most important messages that have come out from today and the takeaways from today?
Right, thank you. Thank you for the introduction. And first and foremost, I just want to also express my sincere appreciation and thank you for today's very informative session. It's been inspiring, it's been motivating, and for me as a newcomer to the MRT process, really something special. So I just want to acknowledge that first and foremost. I will sort of summarize my reflections in terms of 3 words and 1 sentence. The 3 words, they are optimism, adapt, and leadership. Optimism in terms of the future work that we do and the partnership that we have. Adapt, we all have heard that we are living in a very challenging, complex, and volatile environment. So how do we continue to think about our model and our ways of working to really embrace the challenges, but also the opportunities that we've heard today? And thirdly, at the end of the day, it is about leadership. Collective leadership is the essence in terms of success for us as an alliance. And on the billboard outside with regards to the next billion, I did write my sentence in terms of the next billion with less than 10 years. Now, I don't know if that number is correct, but I think we have to aspire to something really special because the urgency is there to drive impact.
All right, and that's a great answer. Let's build on that, though. How well do you think the Alliance is positioned to take on the challenges it faces and the challenges that have been brought up on the stage and in the room as well?
Right. I think first and foremost, obviously after 22 years of experience, there's a lot of learnings. And how do we take those learnings and improve on our work by also coming up with concrete and impactful ideas, ultimately sort of supporting and driving the priorities and the needs of our implementing countries, number 1. Number 2, you've also obviously heard today throughout that there is a lot of very good ideas when it comes to innovation, but I think we've only scratched the surface. I think there's so much we can do, especially also to build the relationship between the private and public sector. So innovation, how can we more leverage innovation in a much bigger, impactful way? And then I would say, success can also sometimes lead to complacency. But in our world, our culture, we don't have that. And the 2 examples that I can share is obviously through the pandemic and COVAX delivery, we did amend and adjust our strategy from 5.0 to 5.1. And secondly, we have also launched an aspirational and ambitious operational excellence program within the Secretariat, recognizing that that is a critical enabler for us to make sure that we are successful with the execution of our 5.1 strategy, but also to set us up for 6.0, the next phase as we move into 2026.
I know we've spoken about a lot of people's experience here. You just joined Gavi last year. What has the experience been like?
Yeah, I would say, reflecting on that, one of the most important topics for me is really listening. Listening is one of our core values at Gavi. Respect is another core value. So how do we really make sure we listen to our stakeholders, the donors, the alliance partners, and also the implementing countries? And we do that also by taking feedback, constructive feedback, in a very humble way. And how do we then also turn that into, once again, in concrete improvement action? So I think that one is very important to me. I've also sort of experienced the complexity. I think we have way overcomplicated our work and the way we do things. So there's a huge opportunity to really streamline the way we are working. And the third one is we need to continue to focus on our people and culture. I think you've also heard today from Chad, also at some of the breakout sessions with regards to our sustainability, that people at the end of the day is so important. The healthcare community workers, we heard the 3 S's in terms of how do we think about their skills, how do we think about support, how do we think about salaries. So at the end of the day, the people and culture matters. And that is a critical piece of success when we talk about operational excellence as well.
Thank you so much, David. Really thought-provoking reflections, so brief and succinct as well. I love that it was towards the end of the day. Considerations that we can take away with us as we prepare for the third and final day. I would like to thank all of you for remaining in the room until the very end and being such an engaged audience. Interactions like these are the lifeblood of our alliance. I see we've got about 5 to 10 minutes. I'm checking if there's any questions for David as we wrap up this panel.